What do you think the lasting impact of the pandemic is going to be on health IT?
I love this question because I created like six questions from it. And that's only because not to be annoying and answer a question with a question, but it really got me thinking about some of the things we need to be prepared for because, how are we actually accelerating digital engagement and digital health? And I'm just talking about telemedicine. Like what are the things we're actually doing that we're seeing are stickiness and, lifetime value of some of the things we're bringing forward. What's really important is constantly planning for unknowns in that crisis management space and continued disruption. We weren't very good about putting disruption in place because you had to go through like 50 committees to do it. So by the time you actually decided what you were going to do, it really wasn't disruptive. It was just like a relief to finally get it in place. Most people weren't even excited about some of the things they're putting in place. So you've got to create that startup kind of mindset and the ability for people to be like good enough gives us a minimum viable product to test out and try and either do it or not do it. We would talk about it, but we didn't actually do it in a lot of organizations. There's always this hesitancy to disrupt things because disruption can actually lead to either it's not going to be profitable or you're going to make somebody mad or whatever reasons. But I feel like we were able to ditch some of the bureaucracy around some of our decision making. But I think really it's how you make investments and changes in your IT workforce. And what does it look like over the next 24 months? I've never met anybody in my company in person. Anybody.
That's amazing.
I interviewed on Zoom. I work on Zoom. I have literally not met anyone face to face. And so how you can actually curate and build relationships and how do you build trust when you've never met somebody in person? Like you don't get to break bread. You don't get to have a beverage. You don't get to go bowling yet, do those things that you might do for team building. We're getting there. But I believe that if nothing else, the lasting impact on health IT is our ability to be innovative and try things in a new and different way and not have to let bureaucracy and red tape be one of the dictations about how we are willing to try something. But also, we have a truly distributed workforce. And I worked in that environment for a lot of years, so I was comfortable with it. But now we really can say, we actually need somebody for 3 months. Let's contract out this one piece of the puzzle, or let's go pull this over here. Or, hey, we can be in 23 different states and be on the same team and get things accomplished and done because you're willing to go that extra mile sometimes because, hey, so-and-so wants to go to their kid's soccer game and they live in Florida. That's 2 p.m. for me, 5 p.m. for them, but they're willing to get back online at 7 after the game is over before dinner. And it's 4, like you start to like make these trade-offs because you're all trying to achieve the same thing, but you're getting to live your life at the same time. And that's what I've loved about what's happened is we all get to live our lives and do our jobs and create new opportunities to make things happen.